Hello everyone. Today we are going to discuss a topic on osteoporosis. So what is osteoporosis? Osteoporosis is a condition in which the amount of bone mass, that is, the following three terms are very important: low bone mass, bone fragility, increased fracture risk. This occurs due to decreased calcium amount in the bone. Why the amount of calcium in the bone is being decreased? So we should understand why the amount of calcium in the bone is being decreased. Based on our understanding why it is being decreased, the treatment will be given. So what are the main three parameters? Low bone mass, bone fragility, increased fracture risk. The first thing is we should know about osteoclast and osteoblast. So osteoblasts are the cells that make up the bones, whereas osteoclasts are important for resorption, that is, they can dissolve the bone. Resorption. Osteoblasts are for construction of bones. Osteoclasts are for resorption, removing calcium from the bone. So why both are important? For example, if you want a bone like this, osteoblasts are forming a bone like this. Let us think there is more calcium here. So a bone is formed like this. So to shape that bone into an appropriate shape, the osteoclast will work on this. They will remove the amount of calcium here, so the bone is finally in a good shape. So both osteoblast and osteoclast are required. Only appropriate amount of calcium must be present in the bone. It should not be too high and it should not be too low. So the first thing, what are the major causes for osteoporosis? Osteoporosis is majorly seen in women because of this first condition, post-menopause. Due to hormonal changes after menopause, women are more prone to osteoporosis. Next one is age related, that is, it comes in most post-menopause, whereas in rarely men also develop osteoporosis. Secondary osteoporosis. What is secondary osteoporosis? Osteoporosis which occur due to other conditions are called secondary osteoporosis. It may be due to medications or other diseases. Other diseases which cause osteoporosis are hyperparathyroidism. In hyperparathyroidism, the parathyroid hormone will be increased. Because of this, the amount of calcium in the bones will be resorbed in the blood. Because of this, the bones will be becoming thin and the bone mass will be decreased and bones become fragile and they are easy to break. Whereas medications like steroids and other medications can also cause, like for example, increased doses of thyroid hormone, increased doses of vitamin A, increased prolonged use of heparin, like example around more than 15,000 to 30,000 units for around 3 to 6 months may also cause osteoporosis. What is the pathophysiology? Simple pathophysiology we are explaining. Increased osteoclast activity. So this is a major causes. Decreased estrogen. When the estrogen level is decreased, osteoclast will be stimulated. The osteoclast activity will be increased, so bone will be resorbed. Next one is decreased transformed growth factor. It will also do the same thing, increased osteoclast activity. Other cytokines can also increase this osteoclast activity. Other than these two, medications, different medications like steroids, heparin, thyroid hormone replacement therapy, phenytoin, phenobarbital. These are major medications that everyone should remember. What are those? Steroids like prednisolone. Prednisolone above the dose of 7.5 milligram can cause osteoporosis. Steroids. Next one is thyroid hormone replacement. Overdoses usually, and phenytoin. Other than these three, one more important is heparin. Heparin at a dose of greater than 15,000 to 30,000 international units for 3 to 6 months. This may also cause osteoporosis. Now, how should we test? First will be physical examination. Patient will be having severe body pains like that. Other than this, we should be testing appropriately. What is the diagnostic test that we should be doing? Complete blood picture, serum calcium, ESR, erythrocyte sedimentation rate, parathyroid hormone levels. It will be elevated in this condition. Thyroid function, to determine whether the patient is receiving any thyroid therapy, also important. Vitamin D levels in the patient, 24-hour urine sample to estimate urine calcium and creatinine levels. Other than this, there are some tests called bone mass density. It is BMD test. Bone mass density test is very important. Usually people above 35 to 50 years must be regularly undergoing bone mass density test, but it's not advisable because of some other radiation and other effects. How do they assess? Based on bone mass density test, there will be a score called T-score. In a normal patient, T-score will be greater than -1. T-score will be greater than -1 in a normal person. Whereas for patients with osteoporosis, T-score will be lesser than -2.5. If it is lesser than -2.5, it is considered as osteoporosis. If T-score is greater than 1, there it is normal condition. So all these are the tests that need to be done to evaluate if a patient is having osteoporosis or not. Other than BMD, we can also X-ray. Next, treatment that has to be given for patients. The major drugs that are being given to these patients comes under categories of bisphosphonates. Bisphosphonates like alendronate, rosidronate can be used for the treatment of osteoporosis. And selective estrogen receptor modulators are being used these days. Selective estrogen receptor modulators are different. For example, some are used through different routes. Raloxifene, calcitonin, and this drug is very important. Teriparatide. Teriparatide, the formulation, patented formulation is very costly of teriparatide. It's around 25,000 per injection. So teriparatide will be given as subcutaneous dose. For around 6 months to 1 year they will be giving, and if required we can be given up to 2 years. The dose will be around 200 units per day. So this is a simple explanation for osteoporosis: the pathophysiology, causative factors, diagnostic test, treatment. Thank you.